Hi folks, this is John Adamson, the Rehab Man Documentation Guru, and today we're going to look at a very good speech therapy analysis. I'm going to point out some possible opportunities in this analysis because, like any documentation, there's always probably room for improvement, and even the best documenters can have opportunities to elaborate in their documentation. And frankly, with productivity and being interrupted while we're writing these notes, it can be hard to capture everything that we need to express. But this gets the point across very well, and I just wanted to highlight that and talk through it sentence by sentence. So let's delve into this. Patient is tolerating mechanical soft and honey thickened liquids without signs and symptoms of aspiration. Now, if that had been the goal, mechanical soft and honey thick, then basically what the therapist has said is, at this point, we're done with therapy. We've met our goals, but that was not the goal for this particular patient. Patient had a goal of thin liquids and regular consistency. So that was their long-term goal. Patient is tolerating trials of nectar thickened with use of chin tuck with few signs and symptoms of aspiration. Now, this is good. This is evidence that there's potential progress above the honey thickened liquids, and there's techniques that can be utilized like chin tuck. Now, a couple things about this. Number one, chin tuck is a fairly simple technique, and it can be trained to a non-skilled person very quickly, very effectively. So we're going to look and see whether the therapist justifies ongoing therapy related to that. And the word few. Any use of words that are not specific objective words lends itself to diminishing the value of your analysis. And so the word few doesn't really tell us what those signs and symptoms are. And a speech therapist would know there are lots of opportunities to assess by the naked eye what's going on from an aspiration standpoint. So having this therapist describe those signs and symptoms would be very helpful. Patient requires moderate cues to perform chin tuck and is utilizing technique with 50% accuracy with cues. So the patient's 50% utilizing chin tucks, 50% of the time not. So what could be a very simple fix for this patient might entail just turning them over to a restorative program or to a caregiver who is watching them throughout the meal, and that might be able to solve the problem. Doesn't necessarily indicate that ongoing speech therapy is necessary, but the speech therapist goes on to talk about some other concerns. Patients, VFSS, so the videos fluoroscopy, report was received, and patient was found to have aspiration and penetration with thin and nectar thickened liquids. So the very thing that they're working on in speech is causing penetration. That's a big concern. And it was eliminated with the use of chin tuck with nectar, but not with thin. What has the therapist established? Well, at this point, they've established that their thin liquids long-term goal is no longer appropriate, at least as we can see from now, if the patient is not improvable in the impairments causing the aspiration of thin liquids. So the goal for nectar looks appropriate, getting them 100% safe and effective with that. This again points to the need for some kind of intervention. Now the question of whether it's skilled or not remains to be seen, but let's go on to some further analysis here. Patient has premature spillage to the valleculae, forgive me speech therapist if I said that incorrectly, causing aspiration and penetration. Now the fact that the therapist has a knowledge that can identify things like premature spillage, valleculae, anatomical references indicates a knowledge level that is above anybody besides a speech therapist and maybe a very select few skilled practitioners, not a nurse reviewing this claim. So the use of terminology and clear evidence of knowledge is going to help prove skill. Patient with reduced base of tongue retraction and reduced laryngeal elevation. Now, what has the therapist done here? This therapist has identified two underlying impairments, base of tongue retraction and laryngeal elevation, that she can work on in this case. And that's going to be an evidence of further skilled necessity, and that's a good thing to point out. Now, I know that these things can be hard to objectify. I've talked to speech therapists about objectifying these things, and it can be difficult for them to put an actual number on base of tongue retraction and things like that. But any way they can utilize to objectify this any further would be very helpful. But again, this is a good proof of skill. Patient has met the goal for food consistency. Okay, so this patient had a short-term goal for mechanical soft. Cannot be upgraded due to regular solids due to lack of dentition. So what the therapist has done is they've indicated that there's going to be a change to their goals. There's no opportunity at this point for food consistency improvement, but there is appropriate opportunity based on objective findings for improvement to nectar thickened liquids from the current honey thickened. And so when I say this is a very good speech therapy analysis, while I pointed out there were some opportunities, they still do a very good service to their documentation and proving that they are actually medically necessary. This has been John Adamson, the Rehab and Documentation Guru, reminding you to get paid for what you do, and in this case by writing good analyses. Take care and God bless.